Assalamu alaikum. Now we are going to continue our lectures for the third year medical student, and we are going to discuss today the examination of the patient. So after we finish history taking, we have to start examination, starting with the general physical examination. We call it also physical examination, medical examination, clinical examination, or even checkup. Examination is the process by which a medical professional investigates the body of a patient for signs of a disease. So we are going to look for signs, for example, anemia, cyanosis, jaundice, and etc. It generally follows the taking of a medical history. So to reach a proper diagnosis, we have to have a good history, good general physical examination, then systemic examination. You can send the patient for investigation to reach proper diagnosis and to decide treatment. Proper examination needs cooperative patients, so sometimes you face a patient which is uncooperative and difficult to continue examination, or examination of a patient may be tired or ill. He may need special care and consideration. You may need to postpone a routine examination and perform only the examination which is necessary for a provisional diagnosis. But generally speaking, بشكل عام, the examination should be carried out as gently as you can, as possible, in a good light and good bed. Before examination, you have to have a quick survey to the patients. By looking to the patients quickly and rapidly, you can assess the degree of the illness, which is very important in starting examination of the patient. You need some equipment, as I mentioned before. You need a cotton swab, a sphygmomanometer to measure the blood pressure, the flashlight, doing a light reflex, stethoscope, lubricating jelly, tape measures, thermometer, auto-ophthalmoscope, tongue depressor, tuning fork, rectal gloves, vials of coffee and cinnamon. For example, if you want to examine the first cranial nerve, the olfactory nerve, you may need special odor or smell. Reflex hammer if you want to do a reflex. So these are the tools you may need during examination with the patients. And you have some steps in starting examination of the patient generally, the general physical examination, starting with the assessment of the mental state and emotional state of the patients. وهاي ممكن during history taking انت راح تعرف mentality of the patients, the emotional state of the patients, أو ممكن نشوف gait and posture of the patients, the face of the patients, looking for the skin, for the eyes, mucous membrane, mouth, for example, looking for anemia, for cyanosis, for jaundice, for any mouth ulceration, for example. Then you have to examine the neck. The neck is very important as part of general physical examination, and in the neck you may have a lymph node enlargement, so examine the lymphadenopathies, the examination of the thyroid if the patient got goiter, salivary glands, for example, submental, submandibular, or even parotid enlargement. If the patient have MUPS, for example, you may examine the pulsation in the neck. We have both arterial and venous pulsation in the neck. And the most important pulsation is the jugular venous pulsation, which should be part of general physical examination and should be measured. The examination of the axilla and breast, the examination of the hand and feet, either looking for cyanosis, for jaundice, for clotting, for any abnormalities, any deformities. You can look for the vital signs by examination of the pulse or the oxygen saturation using oximetry, the temperature of the patient, the blood pressure of the patient, the respiratory rate of the patient, and if he has a special odor or smell, for example, acetone smell in diabetic ketoacidosis. He may have a uremic smell in chronic kidney disease. He may have alcohol smell if he's alcoholic, for example. So you have to mention all these types of smell. The mental state of the patients with the expression of the patient is important. مثلا patient ممكن يشوفه mask face خاصة إذا patient كان Parkinson disease. There's no any expression in the face, or he is malingering or exaggeration or hysterical. أيضا quick survey to the appearance of the patients, whether he is comfortable or discomfort. فإحنا من نبدأ نقدم الكيس تقول this patient is looking comfort or he is looking discomfort, and why he is discomfort, possibly because he is dyspneic, for example, or he is orthopneic, or he has some acidotic breathing. مثل ما قلنا acidotic breathing اللي نشوفه in patients with diabetic ketoacidosis or uremic acidosis, or in aspirin poisoning, or he may have hysterical or psychogenic hyperventilation. In the consulting room, while the patient's walking, look for the patient's natural gait and any defect in the posture and physical appearance. فإذا ممكن نشوف if he is obese patients, he may have morbid obesity, he may have acromegaly, he may have achondroplasia or dwarfism, and any other abnormal physical finding. Then in the face, you have to look for anemia, and examination of the anemia in the face is very important, looking for the conjunctiva, looking for cyanosis in the lips and in the mouth, in the tongue, and even in the limbs. Looking for jaundice even in the sclera, in the mucous membrane, and in the hand of the patients. ندور على patients at the butterfly rash, for example, if she's pregnant, clavasma, melasma, or she's have a systemic lupus erythematosus, or mitral stenosis, hypothyroidism. هاي يسوينا butterfly rashes. And look for the telangiectasia, color of the skin, مثلا patients and the hyperpigmentation. For example, in patients with Addison disease or hyperpigmentation, hemochromatosis, primary biliary cirrhosis, drugs, etc. يسوينا hyperpigmentation. Or we have skin atrophy, نسميه paper-like skin, very thin skin, especially in patients taking steroid. You have to mention even the health distribution. Pale skin sometimes does not reflect the presence of anemia, so the color of mucous membrane of the mouth and conjunctiva gives a better indication than the skin. طبعا pale skin نشوفها بالأنيميا, in case of anemia when there is reduced hemoglobin, in patients with hypopituitarism when there is pituitary failure, or in patients with nephrotic syndrome. Hyperpigmentation مثل ما قلت possibly due to chronic kidney disease CKD, or Addison disease, or hemochromatosis, or primary biliary cirrhosis. طبعا CKD with chronic kidney disease or chronic renal failure الcolor نسميه earthy color. This is the way to examining for anemia, looking for the conjunctiva. هنا راح نشوف pale conjunctiva. This is anemic patient showing pale conjunctiva. This is the method for the examination of anemia. This is the butterfly rash اللي قلنا ممكن نشوفه in pregnancy, systemic lupus, mitral stenosis, hypothyroidism, and others. This is a edema of the face. We call it periorbital edema in patients with nephrotic syndrome. And we buffy face, and even maybe the lips also swollen. This child showing periorbital edema or buffiness in the face, especially in patients with nephrotic syndrome, and especially in the early morning. فنشوف هاي complaint very common in our clinical practice. Patient come to you and he's suffering from periorbital edema. This is hyperpigmented women. It may be due to Addison disease, مثل ما قلنا hemochromatosis, an increase in the iron load, or it may be primary biliary cirrhosis, or it may be due to drugs, خاصة cytotoxics, so in hyperpigmentation. Examination of the mouth, you have a lot of finding. ندور على features of anemia, for example. إذا كان anemic فنشوف إذا عنده angular stomatitis in the angle of the mouth, أو نسميه angular cheilitis. He may have glossitis, and the tongue look red and tender. We call it glossitis, and flattening of the tongue in patients with anemia. Mouth ulceration, either mouth ulcers, مثلا in patients with Behçet disease, for example. Oral candidiasis, oral thrush. This is white patches in the mouth due to fungal infection, occur in immune-compromised patients, especially diabetes, for example, or asthmatic patients using steroid, or sometimes in baby who are in breastfed baby. أيضا نشوف a lot of babies have oral candidiasis. We call it oral thrush. Gingival hyperplasia or gum hypertrophy or gum hyperplasia, important finding in the mouth. It may be due to drugs, for example, amlodipine or antiepileptic, methylphenidone or epinephrine. It may be due to leukemia like M5. It may be due to chronic gingivitis, and it may be due to vitamin C deficiency. We call it scurvy. Macroglossia, which is the enlargement of the tongue in patients with acromegaly or in patients with hypothyroidism. Dental caries, bad mouth hygiene, even we may smell bad mouth smell, we call it halitosis. Herpes labialis, when there is viral infection like influenza infection, we may have herpes labialis, herpes virus infection. Altered pigmentation of the oral mucosa in patients with Addison disease, for example. We may have pigmented mucous membrane. Macrognathia, enlargement of the lower jaw. Asymmetry of the mouth angle in patients with, for example, facial nerve palsy. This is angular stomatitis. This is the angle of the mouth. This is red and flattening of the tongue in patients with severe iron deficiency anemia, also angular stomatitis. And these patients also got angular stomatitis and flattening of the tongue due to iron deficiency anemia. This patient showing multiple oral thrush, multiple oral candida infections. We call it oral candidiasis. This is a big tongue in patients with macroglossia, and this is also a big tongue in patients with hypothyroidism or acromegaly. And this is mouth ulceration, and here is the herpes labialis. Painful mouth ulcers or mouth sores in Behçet disease. The ulcer is raised, round lesion in the mouth that quickly turn into painful ulcers. You can very painful ulcers in patients with Behçet disease, especially during eating or drinking, especially hot drinks. The sores usually heal in 1 to 3 weeks, still healing, but طبعا commonly it will recur. So recurrence rate is very high in those patients with Behçet disease. This mouth showing hyperpigmentation. This is a hyperpigmented area, hyperpigmented spots, أيضا hyperpigmentation in patients with Addison disease or hypocortisolism due to adrenal insufficiency. And this is gum hyperplasia or gum hypertrophy, مثل ما قلنا نشوفها drugs like amlodipine, antihypertensive, calcium channel blockers, antiepileptic مثل epinephrine or phenytoin. شوفها in vitamin C deficiency مثل scurvy, we call it scurvy, in patients with leukemia, especially M5. أيضا in patients with chronic gingivitis with bad mouth hygiene ممكن نشوف gum hyperplasia. This is enlargement of the tongue, enlargement of the protrusion of the lower jaw. we call it macrognathia in patients with acromegaly, وهذا طبعا عكس هذا المicrognathia. Macro and micro. Cyanosis. What is cyanosis? It is a bluish discoloration of the skin, nail beds and mucous membrane due to ليه صار عندنا cyanosis? There is reduced hemoglobin, increased deoxygenated hemoglobin in the blood. Cyanosis نشوفه وين deoxygenated hemoglobin أو reduced hemoglobin يصل بين 4 إلى 6 جرام per deciliter. فإذا وصلنا لل 4 إلى 6 جرام per deciliter مثلا 5 جرام per deciliter deoxygenated hemoglobin, the patient will show cyanosis. This blood is bluish or purple, giving the skin, the mucous membrane, their appearance. Desaturated hemoglobin rarely causes cyanosis until it amounts to more than about 5 gram per deciliter. مثل ما قلنا يعني 30% of the total amount of hemoglobin in the capillaries. فمن يوصل reduced hemoglobin أو deoxygenated hemoglobin تقريبا 5 جرام per deciliter and more, the patient will have cyanosis. طبعا هذا راح يكون very difficult to be seen in anemic patients and very easily to be seen in polycythemic patients. Normally approximately احنا بنخلي oxygen saturation بين 80 إلى 87% oxygen saturation. هنا the patient will give rise clinical appearance of cyanosis. However, in cases of anemia where hemoglobin levels are low, lower oxygen saturation may show up as cyanosis. يعني ممكن يوصل 80 الساتوريشن بس ما عنده cyanosis. ليش؟ لأن هو anemic patients. That's to say a hemoglobin level of 6 gram per deciliter, for example, shows cyanosis only when oxygen saturation has dropped مثلا to 60%. In anemic patient, it's difficult to show, harder to see a cyanosis. بينما in polycythemic when عندنا high hemoglobin level راح نشوف cyanosis more easily. We have two types of cyanosis. We have central and peripheral types of cyanosis. Central cyanosis due to defect. ليش صار عندنا central cyanosis? Defect of oxygenation of blood أو mixture of arterial and venous blood. إذا هنا defect أما بالاكسجينيشن مثل chronic obstructive pulmonary disease defect وين؟ بالاكسجينيشن أو بالheart failure. أو defect وين؟ in mixture of arterial and venous مثل ايش؟ مثل congenital heart disease مثلا tetralogy of Fallot, total anomalous pulmonary venous drainage مثلا tricuspid atresia. We have many congenital heart disease causing cyanosis نسميها cyanotic congenital heart disease. وعندنا acyanotic مثل BSD وال ASD. فإذا عندنا congenital heart disease أو COPD أو heart failure يصير عندنا central cyanosis. السنترال cyanosis راح نشوف cyanosis اللي هو bluish discoloration both in the tongue and in the limbs. يعني نشوفها بإيديه برجليه وأيضا in the tongue, in the mouth, in the mucous membrane, in the lips. In peripheral cyanosis هنا due to defect in the blood flow, defect in the peripheral circulation. Arterial blood stagnates too long in the limbs and loses most of its oxygen. The tongue is unaffected مثل ايش؟ مثل during cold exposure مثلا يصير الهاند bluish discoloration أو venous obstruction عند البيشنت DVT أيضا يصير عندهم cyanosis أو Raynaud phenomena أو heart failure. إذا heart failure can cause both central and peripheral cyanosis. Central cyanosis in the tongue and limbs, in peripheral only in the periphery. This patient showing cyanosis of the lips, mucous membrane, tongue, lips, mucous membrane. This is the hand showing cyanosis with the clubbing طبعا واضح هذا drumstick clubbing cyanosis مبين how the child got cyanotic congenital heart disease. Examination of the neck is very important. We have a lot of structures important in the neck. For example, we have the lymphadenopathies, the lymph node يعني thyroid gland, salivary gland اللي قلنا مثل parotid, submandibular, submental. Examination of the pulsation in the neck اللي عندنا carotid pulsation أو jugular venous pulsation. الjugular venous pressure أيضا لازم نطلع قد الأكسيلا and the breast. نبدي هسه بالlymphadenopathy, lymph node in the neck. The major lymph node groups are located along the anterior and posterior aspects of the neck. طبعا هنا sternocleidomastoid راح نقسم إلى anterior and posterior aspect of the neck. And to palpate, use the pads of the all four fingers ما عدا thumb, as these are the most sensitive parts of your hands. Examine both sides of the head simultaneously, يعني من نفحص left to side, left or right side at the same time, walking your fingers down the area with gentle pressure حتى نشوف إذا any mass, any swelling, lymph node for example. The major groups of lymph node in the neck are, انتوا عارفتوها بالاناتومي لازم تعرفوها. We have this is the way to examining for the lymph node using the four pads of the four fingers, and this is the major groups of lymph nodes اللي هي periauricular, post-auricular, submandibular lymph node, هذا tonsillar, هاي segmental lymph nodes. طبعا هنا راح نشوف السبمنتال ايضا salivary gland، هذا submandibular salivary gland، وهنا الباروتيد ايضا salivary gland. نرجع للليف نود، الليف نود عندنا periauricular, post-auricular، وهنا عندنا submandibular tonsillars، وهنا الانتيريور cervical، وهذا البوستيريور cervical، وايضا عندنا supraclavicular lymph node، ممكن posteriorly نحس الاوكسيبيتال lymph nodes. ايضا اذا بدنا نكمل الليف ادينوباثيز نفحص لازم الاكزيلا، الابيتروكيلير، الانguinal lymph nodes, trochlear lymph node, and even para-aortic lymph node may be palpated. طبعا lumps in the neck يعني any swelling احنا نسميها lump. For example in the neck ممكن تكون lymph node enlargement، ممكن تكون secondary tumor، ممكن يكون primary tumor like lymphoma. Any mass or lump in the neck or elsewhere in the body، يعني any mass، شفنا mass in the neck or anywhere in the body، لازم انت you have to mention the site of the mass، موقعها، the size يعني centimeter 2 or 3 centimeters، shape of the mass مثل rounded mass, triangular mass، the surface of the mass مثلا smooth surface or regular surface، the edges مثل rounded edges، consistency مثلا firm inconsistency, soft inconsistency or hard inconsistency, if it is tender or not, if it is mobile or attached to the underlying structures, if it is pulsatile, if it is fluctuating mass, and then we can use the torch looking for the transillumination. فنقول transillumination of this lump is positive, our transillumination of this lump is negative. Examination of the thyroid will be in the next lectures, and thank you very much.